This April, the heart of direct primary care beats in Music City. Hint Summit is coming to Nashville, Tennessee, April 8th through 11th, 2026. In line with this year's theme, Healthcare in Harmony, Unifying the Direct Care Ecosystem, Hint Summit 2026 will unite the direct care ecosystem, clinicians, employers, brokers, and partners to play in harmony. Gain insights, forge connections, leave with tools to amplify your practice and your voice. Early bird tickets are on sale now at summit.hint.com. Save $100 on your Hint Summit 2026 ticket through October 31st and join the chorus of direct care leaders shaping tomorrow. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care. Hey, my DPC Story listeners, Marielle here. I wanted to share something that happened that was super special this week. I had the incredible honor of being invited to speak on a panel at the Robert Wood Johnson Health Policy Fellows Foundation event in Washington, D.C., and that's where I'm at recording here. It's so truly humbling to be part of this important national conversation about healthcare policy alongside amazing women, and you can read more about that on LinkedIn and our Substack. But to be alongside other women leaders who are making change happen because they're sharing their stories similar to the physicians who have shared on My DPC Story. And because of me being in Washington, D.C., here on No King's Day on October 18th, I will be dropping our next main episode next week. So I don't want to leave you hanging in the meantime, and I want to make sure that you are aware. If you're not, please download the free third issue of our magazine that My DPC Story puts out, specifically focused on direct primary care, called The Toolkit. It's a free magazine, again, focused on open enrollment and helping your DPC clinic prepare for this open enrollment season that started 3 days ago. So inside the magazine, you'll find an open enrollment feature that starts with a simple truth that every fall coverage resets while life keeps moving. And that is very much true, even though the government has shut down. Formularies are shuffling, networks are tightening, and employers rebid benefits. And by January 1st, patients want one thing: confidence that nothing important fell through the cracks. And we know very well what that feels like when we talk with our patients about their healthcare benefits from even before we open our clinics to 5 years plus in. The issue walks through how DPC can be a steady hand and how specifically our relationship-based primary care can help prevent pharmacy surprises and cost spikes before they even happen. You'll also get practical tools like easy-to-use checklists and scripts you can use in your visits, emails, and texts. So this is a specific issue to help you have confident conversations about Medicare, plan changes, and how DPC fits into a patient's overall healthcare picture without you or anybody else in your clinic turning into an insurance broker. There is a deep dive article on how to prepare for your DPC for January 1st, 2026, including what dates to mark on your calendar, examples of talk tracks with patients, and what to clarify about DPC versus Medicare and Medicare Advantage coverage. And we have a link in our magazine to the Open Enrollment Survival Kit that I put out earlier this week as well, which includes copy and paste templates for texts, emails, social media, and a customizable one-pager in Canva that you can brand for your own clinic and print out or use on your FAQs or presentations that you're doing around your community. There's also an article called DPC at the Crossroads, Why the Time to Act is Now, breaking down how the Big Beautiful Bill, quote unquote, and specifically HR 1 within the Big Beautiful Bill finally allows HSA dollars to pay for DPC memberships. And it's a huge policy win that has been over a decade in the making, and you can read more about it. In that same spirit, there's a call to action to join the upcoming DPC Coalition webinar on November 6th at 1:30 p.m. Pacific. It's all about DPC, HSAs, and the future of healthcare policy. So you can register for the coalition meeting at dpcare.org. That's dpcare.org. And the issue also features inspiring DPC leaders like Dr. Emily Holt in New Orleans, who's redefining healthcare in a world where FQHC models are under pressure. And Christy Snodgrass, many of you might know her. She's a DPC patient as well as a nurse and fierce patient advocate who's helping people fight medical debt and access fair pricing for things like imaging and prescriptions. There's also, it just keeps going, articles on DPC and Medicare to opt in or opt out, what that means for your ability to do side gigs or direct contracting, and an article about health shares for the self-employed, exploring alternatives to traditional insurance during open enrollment, and also protecting the future of DPC from becoming another corporate venture capital driven model, the powerful piece by humanistic benefits advisor and a good friend, Callie Ortega. There's also examples from DPC doctors directly about what they do for their own healthcare plans for their families. And finally, don't miss the callouts for the upcoming events that are noted in the magazine, like the Rise Up Summit, a physician-led virtual event covering DPC, locums, and direct contracting. And that's actually coming up later this week. So you can sign up for that at flexmedstaff.com/riseup. Definitely check out that summit lineup. And if you're practicing DPC in California or planning on it, early tickets for the 2026 California DPC Summit are open for reservation right now. The tickets have not gone live, but the tickets are able to be reserved. And we've had over a third of our tickets already reserved. So it's going to be in Newport Beach in June of next year. So definitely get on that soon. CaliDPC.com is where you're going to go to reserve one of those tickets. So while I'm in DC this week representing DPC at the policy level, I hope you take some time to read through this incredible issue of the toolkit. It is, again, filled with resources to help your clinic thrive through open enrollment and beyond. You can download it for free at mydpcstory.com/magazine. So until next week, take care, stay inspired, and keep doing the good work. I'm going to go to sleep and wake up rested and excited to be refreshed tomorrow and keep fighting the good fight. Thank you for listening to another episode of My DPC Story. If you enjoyed it, please leave a 5-star review on your favorite podcast platform. It helps others find the show. Have a question about direct primary care? Leave me a voicemail. You might hear it answered in a future episode. Follow us on socials at the handle @MyDPCStory and join DPC Didactics, our monthly deep dive into your questions and challenges. Links are at mydpcstory.com. For exclusive content you won't hear anywhere else, join our Patreon. Find the link in the show notes or search for My DPC Story on patreon.com. For DPC News on the Daily, check out dpcnews.com. Until next week, this is Marielle Conception.